Myasthenia gravis milligrams is a chronic autoimmune disorder characterized by weakness and rapid fatigue of voluntary muscles. The condition occurs when the immune system mistakenly attacks the connections between nerves and muscles, disrupting the transmission of nerve signals to the muscles. Key features of myasthenia gravis autoimmune disease. Milligrams is caused by an autoimmune response that targets acetylcholine receptors at the neuromuscular junction, where nerve cells communicate with muscle cells. Muscle weakness. The primary symptom is muscle weakness that worsens with activity and improves with rest. Symptoms. The symptoms of milligrams can vary in severity and can affect different muscle groups. Ocular symptoms. Weakness of the muscles controlling eye movements, leading to ptosis, drooping of one or both eyelids. Diplopia, double vision. Bulbar symptoms. Weakness in muscles involved in speaking, swallowing, and chewing. Dysarthria, slurred or unclear speech. Dysphagia, difficulty swallowing. Chewing difficulties, problems with chewing food. Generalized muscle weakness, weakness in various voluntary muscles, which may include limbs, weakness in the arms and legs. Neck, weakness affecting the neck muscles, which can cause difficulties in holding the head up. Breathing. In severe cases, weakness of the respiratory muscles may lead to breathing difficulties. Fatigue. Symptoms often worsen with physical activity and improve with rest. Causes and risk factors. The exact cause of milligrams is unknown, but several factors are believed to contribute. Autoimmune response. The body's immune system mistakenly attacks acetylcholine receptors at the neuromuscular junction. Thymus abnormalities. Some people with milligrams have abnormalities in the thymus gland, such as thymomas tumors or thymic hyperplasia enlargement. Genetics. Genetic factors may play a role, though milligrams can occur in individuals without a family history of autoimmune diseases. Other autoimmune conditions. Milligrams may be associated with other autoimmune disorders, such as rheumatoid arthritis or lupus. Diagnosis. Diagnosing milligrams involves several steps. Clinical evaluation, assessment of symptoms, medical history, and physical examination. The pattern of muscle weakness and its fluctuation with activity and rest are key diagnostic features. Electromyography (EMG). This test measures the electrical activity of muscles and can detect abnormal muscle responses. Acetylcholine receptor antibody test. Blood tests to detect the presence of antibodies against acetylcholine receptors, which are commonly elevated in milligrams. Single fiber EMG. A specialized form of EMG that can detect abnormalities in neuromuscular transmission. Thymus imaging. Imaging studies such as chest CT scans to check for thymomas or thymic hyperplasia. Edrophonium test. A diagnostic test where edrophonium chloride, the drug that temporarily improves muscle strength, is administered to observe if there is a temporary improvement in symptoms. Treatment. Treatment for milligrams focuses on managing symptoms, improving muscle strength, and controlling the autoimmune response. Medications. Anticholinesterase medications. Drugs such as pyridostigmine improve nerve-to-muscle transmission and temporarily relieve muscle weakness. Immunosuppressants. Medications like prednisone, azathioprine, or mycophenolate mofetil reduce the autoimmune response. Monoclonal antibodies, rituximab or eculizumab, may be used in some cases to target specific components of the immune system. Thymectomy. Surgical removal of the thymus gland, which may improve symptoms in some patients, especially if a thymoma is present. Plasma exchange plasmapheresis. The procedure to remove antibodies from the blood, used in severe cases or during exacerbations. Intravenous immunoglobulin (IVIG). Administration of intravenous immunoglobulin to help modulate the immune system and improve symptoms. Supportive care. Physical therapy, to help maintain muscle strength and function. Speech therapy, to assist with speech and swallowing difficulties. Prognosis. The prognosis for milligrams varies among individuals. With appropriate treatment, Many people with milligrams experience significant improvements in symptoms and quality of life. However, milligrams is a chronic condition, and ongoing management is often required. Severe cases, particularly those involving respiratory muscle weakness, may require intensive medical care. Complications can include myasthenic crisis, a severe exacerbation of symptoms that leads to respiratory failure and requires emergency medical treatment. Medication side effects from immunosuppressive drugs or other treatments. Conclusion: Myasthenia gravis is a complex autoimmune disorder with a wide range of symptoms and treatment options. Effective management involves a combination of medications, lifestyle adjustments, and supportive therapies. Ongoing research aims to improve understanding and treatment of the condition. If you have more specific questions or need additional information on any aspect of milligrams, feel free to ask.